Hey, we hope you're having a great start to your recovery after your wisdom tooth surgery.
We just wanted to check in with you and make sure you fully understand your post-operative instructions, because we want to make sure your recovery is smooth and that there's no complications.
So you might be wearing that face wrap right now that you got at the office with some ice. You want to make sure you keep 2 in the freezer and 2 on your face.
Keep that ice on for like 20 minutes and then off for 20 minutes for the first 48 to 72 hours.
After that, ice isn't giving you much benefit. You could switch to heat after the 3rd day.
A little bit of bleeding is normal, and if you notice bleeding, fold up a piece of gauze, roll it up, and place it directly on the surgical site and apply pressure by biting down. Keep it in place for like 20 minutes and replace it as you need. Once the bleeding is stopped, usually by 24 to 36 hours, then you don't need the gauze anymore. And if the bleeding continues, you could try using like a wet tea bag and biting on it for like 30 minutes.
Don't wait for pain. The key to taking care of any postoperative discomfort is taking your ibuprofen on a regular schedule every 6 hours. If it's not enough for pain and you don't make it to the 6-hour mark, you could go in between the doses with either regular Tylenol, or you could step it up to the narcotic that we prescribed you if the pain is bad enough.
Do not take both, since the narcotic contains Tylenol as well.
If you had your surgery with an IV sedation, you most likely received your first dose of antibiotics in the office. If you were prescribed antibiotics to take home, please be sure to start them this evening with food and take them on a schedule until you complete the course.
Start rinsing with Paradex twice a day, and if you were given a syringe, on day 5 you could start flushing the sites out twice a day. Be sure when you flush the site that the tip is gently placed at the opening of the site when you're flushing it out. Okay, so now the diet. The first day we want you sticking to cold foods,
such as smoothies, ice cream, jello, or yogurt. The next day you could advance to warm, soft foods such as scrambled eggs, mashed potatoes, or ground beef, but you want to avoid crispy, crunchy, or chewy foods. Sorry, I went off on a tangent there.
Take it easy. No exertion for the first 5 days and no strenuous activities for the entire first week. Don't lay flat. Keep your head elevated, and if you are lying down, use an extra pillow to prop your head up. No smoking.
No smoking.
You can brush your teeth, but be gentle and make sure to avoid the surgical sites. Your sutures will dissolve on their own, typically by the end of the first week.
If you have any questions,
you could check the sheet that's in your bag,
or you could check our website under the surgical instructions.
or just watch this video again.